You woke up to urinate last night. Maybe it was 2 a.m., maybe 4 a.m. And when you get back into bed, you know exactly what is going to happen. Sleep disappears. The mind races. Work. Worries. That appointment you forgot. And then, half an hour after you finally fall asleep again, it all repeats. You get up exhausted. More coffee, more fatigue, and at some point during the day you think, this is normal, it's part of getting older. I am Dr. David Volds. I have worked for 18 years in cardiovascular medicine and nephrology, and I am here to tell you something that conventional medicine will never mention in your doctor's office. That thought you had? It's a well-constructed lie, and that lie is silently destroying your health. If you wake up once a night, your body is sending a clear warning. If you wake up twice or more, it's an emergency alarm ringing, because every time you wake up in the middle of the night, your heart races, your blood pressure rises dramatically, and you interrupt the deep sleep cycle where your brain regenerates, your cells repair themselves, and your heart truly rests. Clinical research we've published shows that repeatedly waking up at night strains the cardiovascular system more than smoking 20 cigarettes a day. This is not an exaggeration. These are proven and verified scientific data. Here on the Body Reset After 50 Plus channel, we talk about how the body changes after 50, and this is one of the most damaging changes that no one is talking about. But the problem is not what you think. When people come to my office, they already have their diagnosis ready in their heads. Men say, "Doctor, it's my prostate. I'm sure of it." Women say, "It's menopause. It's a weak bladder." They are already taking expensive supplements, drinking less water, leaving the body dehydrated, avoiding tea after 6 p.m., sleeping with a dry mouth. And yet, they still wake up at night. Why? Because they are fighting the symptom, not the root cause. The bladder is not the problem. Your bladder is a sensor, an alarm, and it is signaling that something completely different is happening inside your body, and the answer might genuinely surprise you and change your life. Before we get there, I need to warn you about 3 symptoms that require immediate medical attention, not a YouTube video. First, blood in the urine without pain. If you see dark blood or clots with no pain at all, especially if you are over 50, this could be bladder cancer. See a urologist immediately. Do not wait. Do not watch the rest of this video. Second, bone pain combined with sudden weight loss. If your nightly awakenings are accompanied by pain in the pelvis or lower back and you've lost 20 to 40 pounds in 2 months without trying, this needs to be urgently evaluated by a doctor. Third, recurrent fever at night associated with intense night sweats. These symptoms together can indicate infection or other serious conditions. If none of these apply to you, you can breathe easy. You're going to be fine. But the quality of that life deserves to be protected and improved. So let's understand exactly what is malfunctioning in your body. There are 2 fundamentally different types of nighttime urinary problems. The treatment for each is completely different, and what helps one can drastically worsen the other. Type 1. Frequency throughout the day and night. You go constantly, day and night without stopping. Large volumes every time. If you measured everything you produce in 24 hours, it would be 3 to 4 liters or even more. This usually has 2 main causes. First, you drink enormous amounts of liquid. Walking around with a water bottle all the time, thinking more is always better for health. Second, diabetes. Either type 2, where glucose pulls water along in the filtration process, or a rarer condition called diabetes insipidus, where the brain doesn't produce the correct antidiuretic hormone. The urine in this type is very clear, almost odorless, practically transparent. And you go equally during the day and night, without variation. This type needs an endocrinologist and full blood sugar and hormone tests. Type 2 is what interests us today in this Body Reset After 50 Plus video. It is a flood only at night. It is nocturnal. And it affects 60 to 70% of people over 50 who have this specific problem. The clinical picture is like this. During the day, you are completely normal. You work, you run errands, you go to the bathroom every 4 or 5 hours, nothing hurts, nothing burns, everything is fine. But the exact moment you lie down in bed, the nightmare begins. 3 or 4 trips to the bathroom per night. Each time, a full bladder, large volume of urine. In the morning, you are confused and irritable. You drank half a cup of water at night. Where did 1.5 liters of urine come from? This is classic nocturnal polyuria. Your kidneys have completely reversed your filtration schedule. They work at half capacity during the day and at 200% at night. The critical point: if this is your type, the bladder has nothing to do with it. Treating the bladder is useless and can be harmful. Let me tell you about a real patient. I'll call him Marcus to protect his privacy. Marcus was 62 years old, a retired accountant. Organized, methodical, not the type to panic easily. But when he came to see me, he was genuinely desperate and frustrated. He walked in with an entire folder of medical tests: bladder ultrasound, PSA test for prostate cancer, a pile of prescriptions for expensive prostate supplements. He told me his detailed timeline. It started with one trip at night. He ignored it, thinking it was temporary. Then 2 weeks later, it was 2, then 3. In the last year, 4 or 5 times a night, he had done everything the internet and YouTubers told him to do. Expensive brand name prostate supplements, herbal blends. He completely stopped drinking anything after 5 p.m. He slept with a dry mouth and dehydrated. And yet, at 2 a.m., he would get up and urinate half a liter. At 4 a.m., another half liter. At 5:30 a.m., again. Where was it coming from? He hadn't drunk a thing. When he sat in front of me with red eyes from chronic lack of sleep, I looked at his exams carefully. PSA was completely normal. He had a slight prostate enlargement, but not at a degree that produces this specific clinical picture. Bladder was clear, no stones. From a urological standpoint, he was almost healthy and normal. But this man wasn't sleeping right. He was completely exhausted, and he was suffering. So I stopped asking about urinating. I stopped asking about the prostate. I started asking about his life. Any shortness of breath when you do activities? A little. When I climb stairs, I have to stop and take a deep breath. But I thought it was just being out of shape from being retired. Does your wedding ring get tight at night when you try to remove it? Yes, always. And when I take my socks off, there is a deep groove in the skin of my foot and ankle. But doesn't everyone have that? And at that moment, the picture clicked perfectly. I knew exactly what was happening. I said something that left him completely shocked. Marcus, throw all the prostate supplements away. You don't need a urologist. You don't need surgery. I'm referring you to a cardiologist immediately. He looked at me as if I had lost my mind. What does my heart have to do with waking up to pee? I'm running to the bathroom, not clutching my chest. I don't have chest pain. But he listened, and he trusted. And here is what the cardiologist found after full tests: early-stage heart failure, completely hidden, no dramatic obvious symptoms. During the day, Marcus's heart was working at its absolute maximum limit. It couldn't fully circulate his total blood volume, and fluid was slowly accumulating in his body tissues, mainly in his legs and calves. Marcus was trying to fix a leaking faucet in the sink while the main pipe had burst in the basement of the house. Let me take you through the exact physics of what was happening inside his body, because it's happening to most of you watching this video right now. Imagine a clear plastic bottle, half full of water. When it stands upright, the water is concentrated at the bottom. When you lay it down horizontally, the water spreads evenly throughout the bottle. Your body works the same way. 16 hours a day, you are standing or sitting. Vertical. Gravity constantly pulls everything down. Blood, lymphatic fluid, fluid between your cells, everything toward your feet and ankles. When we are young, in our 20s or 30s, our blood vessels work like incredibly strong elastic tubes. The valves inside our veins hold the blood firmly in place. Our leg muscles, when we walk or run, contract rhythmically and push blood upward against gravity with force. But with age, especially after 50, or if we lead sedentary lives, this mechanism weakens significantly. The veins expand and lose elasticity. The valves begin to leak progressively. The muscle pump turns off because we are sitting at a desk or on a couch. Fluid starts leaking through the vessel walls into the soft tissue around them. In the loose connective tissue of the legs, up to 1.5 liters of water can silently accumulate without you noticing. 1.5 liters. That's 3 large cups of tea, and you might not even notice anything visually. Your kidneys don't see this trapped water. It's outside the bloodstream. The kidneys only filter what is actively circulating in the blood. Now comes the night. You get home from work, tired. You eat something, often with a lot of salt, a cheese sandwich, cured meat, preserves, and you sit in front of the TV to rest. From 7 p.m. to 11 p.m., 4 continuous hours, your legs are hanging down. Gravity keeps working against you, fluid keeps building up in the tissues of your calves. Then you turn off the TV and lie down in bed. And here is where it gets critical. This is the turning point. Your legs rise to the same level as your kidneys and your heart. Gravity no longer keeps the fluid trapped down in your legs. All that fluid, all that water that accumulated over 12 hours in the sponge of your tissues begins to move rapidly back into the bloodstream. It is fully reabsorbed into the veins and rushes toward the center of the body. The circulating blood volume rises drastically in just a few minutes. Imagine if someone injected a whole liter of fluid directly into your circulatory system in a single hour. This is not a metaphor or a simplification. It is exactly what happens to your body every night when you have hidden edema in your legs. And at this critical moment, your heart recognizes the problem. When the fluid returning from the legs reaches the heart, the right atrium starts to fill rapidly and expand beyond its healthy normal volume. The heart releases an important hormone called atrial natriuretic peptide, or ANP. This hormone sends a chemical telegram straight to the kidneys: dump the excess fluid immediately, or I will fail. Your kidneys switch to full emergency mode. They filter blood at an accelerated rate, aggressively expelling water and sodium to protect the heart from overload. The result is as predictable as a clock. Within an hour of lying down, your bladder is full. You get up. You go to the bathroom. You go back to bed still tired. But the fluid from your legs hasn't finished moving into circulation. The process continues and continues. 2 hours later, full bladder again. You jump out of bed again, and the cycle repeats 5 or 6 times until morning arrives. This is why Marcus, who hadn't drunk a drop of water since 6 p.m., was running to the bathroom all night like a man possessed. He was literally urinating the fluid from his legs. His legs had stored 1.5 liters during the day, and at night, all of it passed through his kidneys in a cascade. No prostate supplement could stop this because the intervention was directed at the completely wrong organ. So, how do you check if this is happening to you? No expensive MRI, no complex lab work, just your own hands and a few minutes of genuine attention. Test 1. Locating hidden fluid in the legs. Sit comfortably in a chair. Expose your lower leg, the section between your knee and ankle. Find your shin bone, that bony part. It's the hard surface along the front of your lower leg without muscle cover. Place the pad of your thumb against that bone, about 4 to 6 inches above your ankle. Press firm and hold for a full 10 to 15 seconds. The pressure should be steady and constant. Remove your thumb slowly and run your finger over the same spot. What do you feel? If the skin immediately returns smooth and flat, returning to normal, no significant edema is detectable. But if your thumb left a clear depression, a mark or pit that doesn't fill back in for several seconds, you have just located a hidden reservoir of fluid. Even if your leg doesn't look swollen or bulky on the outside, even if it looks visually normal, that mark is physical evidence that your tissues are saturated with water, and at night, all that water will move through your kidneys. Test 2. Practical and simplified urine diary. Take any day and make simple measurements. Use any clear container with volume markings. A measuring cup works fine. Record your urine output separately, during the day and at night. Add up all the numbers. If your nighttime urine production exceeds 33%, meaning more than 1/3 of your total daily output, you officially have nocturnal polyuria. A simple example. In 24 hours, you produce 1,500 total milliliters. If 500 milliliters or more came during the night, this is your situation. Your kidneys have completely reversed their schedule because of edema or hormonal disruption, not because of your bladder, not because of your prostate, because fluid is redistributing incorrectly through your body. If both tests come back positive, the mark on your leg stays visible and you are producing large amounts of clear, colorless urine at night, we can relax. Your bladder is likely completely fine and healthy. You don't need surgery. You don't need expensive and invasive procedures. You don't need lifelong medication. You need to work on your circulation and your daily routine. But first, we need to talk about food, because there are 3 things most people eat at dinner that act like a delayed timer on your kidneys, programming them to work at night. Enemy number 1, hidden salt. We've been trained to think of salt as something that comes out of a salt shaker, but 80% of the salt most people consume comes from processed and industrial foods. Cheese, cured meats, sausages, mayo, commercial bread. 100 grams of common hard cheese contains as much sodium as an entire bag of potato chips. You don't taste it because it's masked by fat and intense flavor compounds. Here's how it works against you. You eat a cheese sandwich at 7 p.m. The sodium enters your blood. Your body immediately activates its defense. Too much salt? We need to dilute this urgently, and it starts to retain every molecule of water it can. At night, you aren't running to the bathroom yet. The salt is keeping water trapped inside your blood vessels and body tissues. But during the night, especially after 3 or 4 hours, your kidneys finally detect this accumulated sodium and start to actively expel it. And sodium acts like a powerful magnet. It must pull water along with it. To expel 1 gram of excess sodium, the kidneys must pass a significant volume of fluid through them. The result, you wake up in the middle of the night not because you drank too much water. You are eliminating the cheese and salt from the night before. Enemy number 2, sugar at night before bed. I had a cup of tea with cookies, a small apple before bed. What's the harm? Let me explain the exact biochemistry. Simple carbohydrates at night cause a rapid and abrupt spike in blood glucose. Your pancreas fires insulin immediately. Insulin, besides managing blood sugar, signals your kidneys to retain sodium and water. First comes fluid retention, then 2 to 3 hours later, exactly when you've fallen into deep sleep, your blood sugar drops. Your kidneys switch to active fluid excretion. Furthermore, if you have even a minimal amount of insulin resistance, which affects a substantial portion of people after 50, elevated blood sugar acts as a natural osmotic diuretic. The sugar itself literally pulls water out of your cells and into the urine. You get the biological equivalent of a water pill just by eating an apple or a few cookies before bed. Enemy number 3, alcohol at night. Many people tell me, "Doc, I only have 1 small glass of wine or a beer before bed. It helps me sleep." Alcohol does help you fall asleep faster. It's a sedative, but it is simultaneously one of the most powerful blockers of the antidiuretic hormone that exists. Remember the signal to the kidneys. Slow down, concentrate the urine, work in economy mode. Alcohol completely cancels that signal. Your kidneys run at full filtration speed without restriction. The sedative effect might let you sleep through the first urge to urinate, but the bladder keeps filling. Eventually, the pressure becomes impossible to ignore, and your sleep quality during the night is profoundly poor. No deep restorative sleep at all. You wake up exhausted with a swollen and painful bladder. Now, let's talk about what actually helps. 3 foods that protect and calm the system. Hero number 1, raw pumpkin seeds. Not roasted, not salted, raw green pumpkin seeds. Pumpkin seeds contain zinc and magnesium in highly bioavailable forms. Magnesium relaxes smooth muscle, including the detrusor, the muscular wall of the bladder. It helps the bladder expand to a larger volume before triggering the urge. The seeds also contain phytosterols, plant compounds that strengthen the pelvic floor. In men, they support prostate tissue. In women, they help with pelvic organ support. A handful, about 30 grams, daily. This is the cheapest and most effective bladder health habit you can build. Hero number 2, cranberry. Not bottled cranberry juice from the store. That contains more sugar than soda. What you need is the actual berry, frozen or fresh, or a standardized cranberry extract from a pharmacy. Cranberries contain compounds called proanthocyanidins. They prevent bacteria from adhering to the bladder lining. Even in people without an acute infection, many adults over 40 harbor low-grade bacterial presence that chronically irritates nerve endings. The bladder becomes hypersensitive. A small amount of urine arrives, and it screams, "Empty me now!" Cranberry reduces this chronic irritation and calms the lining. Hero number 3, magnesium. Not just from pumpkin seeds, a dedicated magnesium supplement 300 to 400 milligrams daily. Magnesium has a direct calming effect on the nervous system. It reduces neurogenic bladder hyperactivity. The bladder stops firing alarms at every tiny sensation and starts to operate in a normal, calibrated mode. Practical summary: eliminate hidden salt at night. Remove cheese, cured meats, and condiments from dinner. Eliminate sugar at night. No fruit, baked goods, or sweetened drinks after 6 p.m. Put the alcohol aside. Add raw pumpkin seeds during the day, a small portion of unsweetened cranberry, and a magnesium supplement. Marcus did just that. He replaced his sausage and cheese dinner with a vegetable and chicken salad. He cut out the nightly tea with cookies. From that change alone, he eliminated 1 trip to the bathroom out of 5. Progress, but not victory. Why? Because food changes alter biochemistry. But if your venous valves are failing and your vessels have lost elasticity, nutrition alone cannot bypass the physics of fluid. We need mechanical intervention. And this brings us to the most practical part of this entire discussion: the protocol that became the decisive final point for Marcus. I call it the 3-step protocol for tonight, because you can start tonight, and you will feel the difference tomorrow morning. Step 1. Leg elevation. About an hour to an hour and a half before bed, while you are watching TV, reading, or resting, do this. Lie down on the sofa or the floor. Place your legs on the arm of the chair, the back of a couch, or lean them against the wall. One requirement: your heels must be higher than the level of your heart. An angle of about 45 degrees works well. You don't need to raise your legs vertically. That strains the neck. Just elevated, comfortable, supported. Stay in this position for 15 to 20 minutes. You can read, scroll your phone, listen to a podcast. What is happening during those 20 minutes? The physics we discussed before. Gravity is now working for you instead of against you. It pushes fluid from the sponge of your lower leg tissue back into the bloodstream. The blood flows toward the kidneys. Your heart receives the volume increase signal and releases ANP. Your kidneys switch to active filtration mode. Your bladder starts to fill, but you are awake. You are in control of your night. 30 to 40 minutes after finishing the exercise, you will feel the urge to urinate. You will go, and you will release 300 to 400 milliliters, the exact volume that would otherwise wake you up at 3 a.m. You understand the principle. You are deliberately squeezing your legs before bed. You are giving your kidneys their nightly workload while you are awake so that at night they can rest. Step 2. Empty your bladder completely before lying down. This seems obvious, but most people go to the bathroom, then spend 30 minutes getting ready for bed, brushing teeth, checking the phone. By the time they lie down, the bladder has partially filled again. The correct sequence: leg elevation for 15-20 minutes. Go to the bathroom, then lie down immediately. No delay, no scrolling, no last-minute chores. Your bladder is empty. Your kidneys have done their night shift. You are ready for uninterrupted sleep. Step 3. Pelvic floor activation. When you are already in bed, lights out, eyes closed, do 20 to 30 repetitions of pelvic floor squeezes. But 90% of people do this incorrectly. They squeeze their buttocks, tighten their abdomen, contract their thighs. This accomplishes nothing. How to do it correctly? Imagine you are trying to avoid passing gas. Or imagine pulling your perineum, the region between your legs, upward like an elevator going from the ground floor to the 5th floor. Your abdomen should remain completely soft. Buttocks relaxed. Only the pelvic floor works, the invisible internal muscle group. Contract. Hold for 3 seconds. Release slowly, 20 to 30 repetitions. This exercise sends a signal through the nerve endings of the pelvic floor directly to your brain. Toned muscles. Secure valve. The system can rest. Neurogenic bladder hyperactivity decreases. The bladder stops panicking with minimal volumes of urine and starts operating in normal mode. That is the complete protocol. Step 1. 15 minutes legs elevated. Step 2. Bathroom, then immediately to bed. Step 3. 20 to 30 pelvic floor squeezes. Marcus started this with skepticism. "Doc, legs up on the wall? Are you serious?" A week later, he came back and said quietly, almost not believing himself, "I woke up once, near morning, once, not 5 times." After another month of consistent practice, he was sleeping through the night. His kidneys stopped working the night shift because he was giving them their work early. His cardiologist noted at the next visit that the swelling in his legs had substantially improved. His heart was working with notably less strain. This method works reliably because it is built on physiology. It is built on physics, biochemistry, and neuroscience. It requires exactly one thing: consistency. This is not a pill you swallow and forget. You do this every day. But that is precisely what makes it genuinely powerful. Your age matters much more than you think. The fluid redistribution mechanism I described becomes progressively more pronounced as the venous system ages. Venous valve competence decreases. Vascular wall elasticity decreases. Cardiac reserve narrows. Research shows that in people over 50, nocturnal polyuria driven by peripheral fluid mobilization occurs approximately 3 times more frequently than in people under 40. How old are you? Comment below. I want to see which age group makes up the majority of viewers because it will directly shape what I cover in future videos here on Body Reset After 50 Plus. So let me give you your action plan. 5 steps for tonight. Step 1. Do the thumb test on your shin bone now. Press and check if a pit remains. Step 2. On your next day off, measure your total urine output and calculate what fraction occurred at night. Step 3. Remove the salt shaker from your table tonight. Replace your processed meat and cheese dinner with something without hidden sodium. Step 4. An hour before bed, lie down and put your legs on the back of the sofa or against the wall for 15 minutes. Step 5. Before sleep, do 20 to 30 correct pelvic floor squeezes. Only the pelvic floor moves. Everything else relaxed. And if the pit on your legs remained after the test, if you notice shortness of breath climbing stairs, if your socks leave grooves in the skin at night, do not go to a urologist first. Go to a cardiologist and a vascular specialist. That is the critical path. Your body is not broken. Your bladder is not your enemy. It is a signal light. Now you know how to turn it off by addressing the cause, not by smashing the bulb. I am Dr. David Volds, and I've spent 18 years seeing what happens when people treat the alarm instead of the fire. Most of the time, the damage was completely avoidable. The protocol I described requires no prescription, no procedure, no money besides perhaps a magnesium supplement. It requires only an understanding of how your body actually works and the discipline to use that knowledge. Your doctor won't walk you through this at your next appointment. There is no prescription in this. And there is no time in a 12-minute office visit to explain fluid mechanics and pelvic floor neurology. This is why Body Reset After 50 Plus exists. Subscribe to the channel, click the like button, and help us reach 10,000 subscribers. Every person who signs up makes it more likely that the next person who needs this information actually finds it. The healthcare system profits from managing your symptoms indefinitely. I profit when you don't need me anymore. If that difference matters to you, if you really want to transform your health after 50, subscribe. This is the truth no one is telling you.